12 News Eye on Agriculture with Britton Rucker.
Hundreds of rural hospitals across the country, including some here in Kansas, at risk of shutting down. Hear what the governor has to say about alternatives if that happens. Plus, it's big news for western Kansas. Hear how a new food processing plant will soon bring hundreds of jobs to Finney County. And a medical specialist announced the death of the pioneering recipient of a pig kidney transplant, but they may be linking his death to. Good evening and welcome into Eye on Agriculture. I'm Britton Rucker. Rural communities across the country are medically underserved. More than 400 of the nation's rural hospitals are at risk of closing. That includes dozens of rural hospitals here in Kansas. That may have you wondering, where will you go if your rural hospital closes? According to Governor Laura Kelly, there isn't a viable alternative, and that could mean a longer drive for you to get some help. It's something emergency response experts say is a big problem.
Cardiac arrest is the one call that time is of the essence. So you have roughly about 8 to 10 minutes to get someone there with high quality CPR and an AED on their chest. Similar, if you're bleeding out, you will bleed out by the time we get there.
The search for innovative solutions continues across the nation. Now here in Kansas, Governor Kelly is still pushing for Medicaid expansion, which she says will help take some of the pressure off of rural hospital systems. Now those hospitals, although, might be getting some help. Senator Jerry Moran introducing legislation to expand access to federal resources for rural hospitals here in Kansas. Through the Rural Emergency Hospital Medicare designation, this legislation would allow previously closed rural hospitals to reopen and apply for the Rural Emergency Hospital designation. Now that's to make technical improvements and keep operating with limited services rather than closing. A beef processing facility in Garden City expected to be a big boom for their local economy. 12 News digital anchor Keith Grant breaks down what people in Finney County could soon see.
Construction is almost done on the Empirical Foods processing plant in Garden City. The plant sits on 50 acres. Finney County Economic Development says it is a big welcome to the growing city. Now, once fully operational, 250 people will work at the plant. The County Economic Development Company says it will also bring an extra 1,000 jobs in support of the plant.
That includes everything from truck drivers to folks who maybe get hired in the beef plants to help support their projects.
We reached out to Empirical Foods to get a timeline of when the facility will be fully operational. They said within the next year. From the 12 News Digital Desk, I'm Keith Grant.
Now, the plant is expected to cost around $250 million to build. That money will come from a capital investment. You'll soon be able to apply to help restore historic barns here in Kansas. The Kansas Department of Tourism is accepting applications for grants they say will increase agritourism in our state. The grant is a program designed to spur economic growth and help create memorable visitor experiences by preserving a significant aspect of Kansas's architectural history. $100,000 will be distributed this year with a maximum of $25,000 available per restoration project. You can apply right now until July 31st. You can find a link to that on the links we mentioned section of our 12 News app and website. Medical specialists announced the passing of Rick Slayman, the pioneering recipient of a pig kidney transplant. They say his death is not linked to the transplanted organ. Tests conducted on the day of Slayman's death indicate the kidney was functioning optimally. While the exact cause of death has yet to be determined, doctors did highlight Slayman's complex medical history.
Mr. Slayman was a patient who had been, fighting ESRD for a decade, right? He had a previous transplant. He was a relatively complicated patient, right? He had a reasonable cardiovascular risk. He had metabolic disease, type 2 diabetes, hypertension, hyperlipidemia, right? So not uncommon for patients that find themselves at this stage in ESRD to have other things going on besides kidney failure, right? So there was other risks involved in the transplant. So we knew that going in.
His medical team commends Slayman's courage, helping the team make significant strides in the field of xeno transplantation. They hope to keep the momentum rolling as over 100,000 people in the U.S. await organ transplants. Still ahead on Eye on Agriculture, a warm spring is causing wheat to mature faster than usual, raising important questions about herbicide application. We'll talk to a weed management specialist from K-State to get expert advice on the issue. And from unpredictable weather to unpredictable farm prices, farmers face many challenges, and it can have a toll on their mental health. The resources out there, still ahead on Eye on Agriculture.